PrEP or pre-exposure prophylaxis is a biomedical HIV prevention strategy in which somebody who doesn't have HIV takes actually a combined pill that has two medicines that have normally been used to treat people with HIV itself. So people who don't have HIV take this pill with the hopes of preventing HIV infection if they were to be exposed. No, so it's been a pretty difficult rollout. It's been a real challenge to get people to embrace the idea of PrEP, and there's a lot of studies out there right now looking at that exact question. It's been especially difficult to get people who seem to be at the greatest risk of acquiring HIV to embrace what in studies appears to be an incredibly effective intervention for preventing the acquisition of HIV. Some of it has to do with just the awareness of whether it's out there. So are the people who need it most aware that it's an option for them? Some of it has to do with providers themselves not feeling necessarily comfortable offering PrEP to patients. There's a question of who is in the best position to offer PrEP. Is it a primary care physician who are more frequently interacting with patients who are HIV negative, or is it somebody who is an infectious diseases physician who, for the most part, is actually interacting already with people who are HIV positive? So infectious diseases physicians don't necessarily have access to the patients, and yet the providers, the primary care providers that have access to those patients don't necessarily feel comfortable prescribing those medications and are not as familiar with them as an infectious diseases physician. Another important barrier is just, do patients know that it's out there? And even if they know that it's out there, that it's an option for them, do they trust it? Do they trust that it will work? Do they themselves perceive themselves to be at risk? And if they don't perceive themselves to be at risk, it's hard to get somebody to take a medicine on a daily basis if they don't think that there's a problem or a risk in the first place that they'd be protecting themselves from. So those are some of the problems. I'm not surprised that people don't want it. I think that there's, in the history of medicine, it always takes a while for things, novel treatments or novel prevention strategies to be accepted by the overall population or even embraced by the medical establishment. So it seems to me that this is sort of the normal course of a medical innovation.